I'm Dr. Sam B. Abraham, Director, Abraham's Infertility and Gynec Center. I have found that very often the pain in abdomen in ladies is overlooked. You know that in the pelvis or lower abdomen there is, you can see the diagram of uterus, tubes and ovaries. So there can be an infection of the tube or ovary. There can be cyst in the ovary. Now this cyst can get twisted. Now what will happen once there is blood flow to the ovary? You can see that once the cyst get twisted, the blood flow gets cut off. So it can cause infection and severe problems. Now what can happen is that you can see here that it is in the tube the sperms and egg meet. So once the sperms and egg meet in the tube, it has to migrate to the uterus. Here what is happening is they don't migrate to the uterus, they develop in the tube. So what will happen? The tube is not able to hold it for long, it gets burst. Now this is called tubal pregnancy. So once it ruptures, what will happen is that it ruptures and the blood gets collected and it will lead to severe problems in the ladies. So this can happen to ladies who are having copper T or other contraceptive measures. Now they may have undergone tubal ligation, so they won't think that they are pregnant. They may be having some irregular cycles. So any lady in the reproductive age, when she is coming with an abdominal pain, she has to see that she is not pregnant. I again tell you, even if you have had copper T or having copper T, or even if you had tubal ligation, this is a distinct possibility. Now they can have infection of the tube, they can have infection of the uterus or infection of the ligaments supporting the uterus. All these things can, if you don't care, it can spread up and can cause severe infection of the uterus and cause problems. This is called what we call as pelvic inflammatory disease. So we have to go into detail their sexual history. Now sometimes what can happen is that they may be having tumors in the ovary, they may be having tumors in the uterus, or it can be that they may be bleeding into the ovaries at the time of menses. This is called endometriosis. And they may be having the uterine lining cells in the uterine muscle. So what will happen? Whenever they are bleeding, they will be bleeding into the myometrium and can cause severe pain. Or it can be due to a intestinal problem. The commonest cause of lower abdominal pain, everybody knows, is appendix. And they can have inflammation of that area, infection of the bowel there. So what I mean to say is that in a lady having abdominal pain, it can be due to so many causes. It can be a gaseous problem, but it can be due to tubal pregnancy, it can be due to cyst in the ovary, it can be due to tumors in the ovary, it can be due to tumors in the uterus or endometriosis adenomyosis. So what I mean to say is that once you see that the symptoms don't subside, don't keep to yourself. Don't wait for the bleeding to proceed, and then unless he faints down, collapses, don't wait for the junction. So it may be in the tube. Don't laugh at it, because I have seen doctors, I still remember one lady doctor brought to in a very collapsed stage having ectopic pregnancy. She had the concept that since she had tubal ligation, it is not ectopic pregnancy. Sometimes you miss it. So we should be very careful about your menstrual cycle. Please note down in your calendar or diary how many days you had bleeding every month. So if you see a prolongation of the bleeding or change in the menstrual pattern, see a doctor, find out the cause. What the problem you had with your friend may not be your problem, it may be a different problem. Try to find it and correct it. This is very, very important. So I mean to say that never overlook your abdominal pain. It can be due to so many reasons. Abdomen is a wonder box. There are so many organs inside it. So be careful.